Welcome back. At some point, you've heard that heart disease is the leading cause of death in the United States. But do you know what it actually is? It's something that we're going to focus on because February is National Heart Month.
Yeah, it's a time to make sure you're paying attention to your own heart health and perhaps some signs that it's time to get things checked out. To talk about that, we have Dr. Don Huey, cardiac surgeon at UT Health San Antonio, joining us for today's KSAT Q&A. Dr. Huey, thank you for being here this evening. And let's start with that very question. Heart disease. When we say that, what exactly are we talking about?
Well, thank you for having me. It's a really important question. As you mentioned, heart disease is the #1 cause of death, and that's true for both men and women in the United States and many other countries. When we say heart disease, we're actually referring to a group of conditions that affect the structure or the function of the heart. The most common type of heart disease is coronary artery disease, and that is what causes heart attacks. That's the buildup of plaque or cholesterol inside the arteries so that the heart muscle does not get enough blood flow. Some other forms of heart disease include problems with heart rhythm, problems with the internal structure of the heart, especially the heart valves. And when the muscle gets weak, it can't pump as well, and that leads to something called heart failure.
Can we talk about how heart disease feels? Because we can describe the different warning signs, but for the people who are watching this, maybe to explain it to them in a different way. How should it feel? Is it being short of breath often?
Yes, that's a common one. So we can think of the warning signs of a heart attack, which most people are familiar with, a crushing chest pain, especially on the left side. Some more subtle signs of a heart attack are pain in different areas, such as the upper back, the abdomen, the neck, or the jaw. But there can also be signs of shortness of breath, as you stated, feeling more tired than usual. Nausea, lightheadedness, or heartburn that just doesn't go away are also signs of a heart attack. But with more chronic heart conditions that are not a heart attack, symptoms include feeling short of breath or fatigue when you're doing your usual or light activity, gaining water weight, or having swelling in the ankles or legs.
Now, with the first set of symptoms that you just mentioned, it's hard to differentiate what's the difference between that and other things. Like you just mentioned jaw pain or maybe upper back pain. I mean, how can people say, okay, this is different, I need to go to the doctor?
Well, sometimes it's really, difficult to ascertain. I would say if it comes on when you're doing something or you're in a stressful situation, that may be more likely to be, a heart attack. If you haven't had any trauma or, caused a crick in your neck, then that may be more likely to be a heart attack. And again, heartburn that doesn't go away with heartburn medication, I really do see that quite commonly here. And people think it's heartburn and they sort of ignore it, and it turns out to be a heart attack.
When people think heart issues, they may think of just that, a heart attack, something that comes on very suddenly. But some of these symptoms, could they last a while? Could they be prolonged and not just instantaneous?
Yes, what we often see, especially with a condition called heart failure that I had mentioned, is that the symptoms are gradual and they sort of slowly develop over time so that people don't notice it, or they think that, oh, well, I'm just getting old, I'm just out of shape, I'm just very stressed out about life, and that's what can make it challenging to recognize. And so I think if you're having those symptoms and they're not really kind of getting better with time, then it would be helpful to talk to your doctor or seek a cardiologist to talk about these things and find out if you have heart disease, because much of it can be reversible or well treated with modern medications and lifestyle changes.
Now, how far along with these symptoms do you have to be in order for your doctor to run a test and in order for the doctor to detect that something is happening with your heart?
Well, you don't even have to be very far along with the symptoms. We know, as I mentioned, it's very common in men and women. 1 in 3 men and 1 in 4 women will develop cardiovascular disease in their lifetime. So catching it early before you develop symptoms is actually very important, because you can prevent permanent damage or long-term damage to your heart if you catch these things earlier. People who are particularly at risk are people who have diabetes, people who have a strong family history of heart disease, especially family members that have had it at a young age, tobacco use. And then the really important risk factors are those that we can change. So a heart healthy diet is one that is low in fats and sugary foods. And then a sedentary lifestyle, especially with COVID, everybody got very sedentary. And we're starting to see younger and younger people develop heart disease because younger people are not getting out and exercising as much. They do more activities such as, video games or social media.
What about men versus women? I've often heard that a lot of times women are guilty of ignoring signs of an issue and saying, it's nothing. I have other things to worry about, and that leading to, more significant heart impacts down the road. Is there a real difference in what you see, men versus women?
Yes, we do see a difference. Historically, women have presented later in life, and we believe that's because there is a protective effect of estrogen. So after menopause, then the disease starts to kick in. The symptoms in women are also more subtle, and that may lead to the underdiagnosis and underrecognition. Women are more prone to have pain in a different area than the chest. They would have it in the back or the upper abdomen, as I had mentioned. They're more prone to have shortness of breath and fatigue rather than, the strong chest pain. We are seeing it in younger and younger women because of those factors that I had mentioned, the lifestyle factors.
Now, before we go, do you have a message, or can you share a message with the people of San Antonio who are watching this as far as what you've seen?
Sure. I think the most important message is that even though it's a serious thing, it's not something to be afraid of. We have great medical care here in San Antonio. And, being afraid and leading to delays in care sometimes is much more harmful than, seeking care early, recognizing the signs, and, just getting checked out with your primary care doctor. And with modern medicines, as I mentioned, and lifestyle changes, people can really kind of reverse disease if it's already set in. It's better to know than to not know.
Dr. Dawn Huey with UT Health San Antonio, thanks for being here this evening.
Thank you so much for having me.
Thank you.
We'll be right back.
Keep up to date with all of San Antonio's top news, weather, and so much more by clicking the like and subscribe buttons below. And once again, thanks for watching KSAT.